Swayam Prabha, free DTH channel for education.
Hi students, welcome back to the online video lectures of medical imaging course. This is the second introductory lecture on medical imaging. In this lecture, let's take a look at some of the real-time clinical applications of medical imaging so that it would give you an idea of how we as an electrical engineer would be able to contribute to different problems in medical imaging. What I will do here is I have picked up here 7 clinical applications, and out of them I think 4 of these applications are the ones which our students at our institute in IIT Tirupati are working. So let's take a look at these applications at a very high level. We will not go into any of the nitty-gritty details or technical details of them. So the first application is detection and classification of traumatic brain injuries in head using CT images. This work is done in collaboration with Dr. Amit Agrawal, and my PhD student Sindhura is working on this problem. So let me briefly introduce what this problem is about. You all know that head injuries are quite common. When a person meets with an accident and taken to the hospital, so the first thing that they usually do to diagnose whether there is any injury or not is to take a CT scan of that person. There are other modalities also acquired like magnetic resonance imaging, but the most common and default modality used is computed tomography. So if you remember from the previous lecture, this uses X-rays. It gives a 3D image of the object of interest. And one thing with CT image or X-rays in general is they could give very good information about the bones. So the skull and other bones, you could very clearly see them. And there are other reasons as well to go for CT imaging rather than the other modalities. This is very fast to acquire, unlike MR imaging, and this is very inexpensive compared to other image modalities, and this is widely available almost in all hospitals will be having the CT scanner. So for these reasons they go for a CT scan. So once the scan is acquired, the doctor goes through it and figures out where there are injuries. So for example, the slide there would be showing you different kinds of possible injuries. For example, epidural hematoma, subdural hematoma, vascular injuries, intraaxial injuries. There are different possible injuries are there. So the doctor goes through it and then figures out what are the type of injuries, and depending on the type of injury, the next course of treatment will be planned. So the purpose of this work is, can we do this automatically and tell that in a way caution the doctor that take a more detailed look at so and so regions in your CT scan, and there is a high probability of a potential injury in these regions. So that's the detection of injuries. So this will essentially help the doctor any of the potential injuries which he may otherwise be overlooking, either because that is tricky to identify, very small or difficult to identify, or it could be because of the amount of slices that he has to go through, okay, for various other reasons as well. It would be also useful if we could be also classify and say that there is a high probability that there is a potential injury here, and this is, for example, let's say intracranial hematoma. So that's the whole objective of this work. For the time being, I'll skip the details of how you come up with algorithms or methods to detect the injuries and classification, but I'm sure you could already see here how image processing could be quite helpful in this application. This is the workflow for this application: classification of normal and abnormal findings, and then you could come up with methods for classification of these injuries as well. There is another application that we are currently working on in our lab here: analysis of psychogenic non-epileptic seizures based on PET CT scans. So let me make you clear what the words here mean. Let me start with simple ones. You already have seen PET scan in the last class, positron emission tomography. Where did it come in our classification there? It comes under nuclear medicine. Essentially, a radioactive tracer is injected, and then its emission is detected, and you will be getting a three-dimensional positron emission tomography scan that gives you the metabolic activity. CT scan you already know by this time. This is an X-ray based scan that gives you the 3D information, 3D structural information. PET scan would give you the metabolic information. So this is again the work we are doing in collaboration with the local SWIMS hospital. The students currently involved are Archana Ramchandran, MTech student, and also PhD student Sindhura is also involved in this work. So let me give you a brief introduction to what this problem is about. You all know perhaps epileptic seizures. So the common term we use is fits for it. So there will be seizures there, okay, and this one can diagnose it based on different modalities also. For example, EEG, where they put a cap here and the electrical activity of the brain is observed there. You can observe an abnormality in EEG scan. Moreover, even CT and MRI scans, if you take both the scans would give you the structural information. There also you could see structural defects. There is another type of abnormality or disease which is called as PNES, psychogenic non-epileptic seizures. So earlier one is called epileptic seizures. This is not epileptic seizure, so you call it as non-epileptic seizures. And the source is psychogenic, okay, psychologically generated to an extent. The problem here is that outward symptoms, if we observe, the patients with PNES will also be having seizures. You cannot observe any electrical abnormality in the electrical activity of the brain from EEG, because the causes of these kinds of abnormalities could be coming from the structures which are there deep inside the brain that might not be picked up by EEG, and structurally you won't see any difference. So even if you take CT or MRI scans, you won't be able to see any difference there. However, the hypothesis here is, if you look at the metabolic activity of the brain, there are certain regions in the brain where you could observe either hyperactivity or hypoactivity. What does that mean? Hyperactivity means typical metabolic activity if you consider in a healthy subject. If the metabolic activity is higher than that, then you call it as hyperactivity. We also call so and so is hyper, means highly active, right? The opposite of that is hypo metabolic activity, where the activity is very low. Metabolic activity is very low. Observation is that there could be structures in the brain where you could observe either hyper metabolic activity or hypometabolic activity when that person is suffering from PNES. So we wanted to validate this. We wanted to do a systematic study here and also see whether we can validate this across a very large population of patients. As a first step towards this goal, we are currently developing the tools that help the doctors to obtain the average metabolic activity, the mean and standard deviation of metabolic activity in each region, and then you map it with the corresponding regions in the patient to be analyzed, and in those regions you compare the metabolic activity of this patient. So yeah, assume that on the left hand side you have PET scans of healthy subjects, and you align them all, bring them all into the same space, and then compute the mean and standard deviations of metabolic activities, compare them with the current subject to be analyzed, and see if you can observe any hyper or hypometabolic activity. So this could help a lot in avoiding the wrong diagnosis into some other category of disease. So this is something that we are currently working on in collaboration with SWIMS Hospital. Another application that I would like to briefly mention is detection and anticipation of epileptic seizures based on EEG signals. One of our master's MS student is working on it. Samir Ranjan Sahu is working on this. By the way, you might be wondering, we have not looked at EEG in the classifications that we have seen. I'm sure most of you know the EEG, electroencephalogram, where you would be recording the electrical activity of the brain. This is not an image that you get, but it's a 1D signal that you would get. So it doesn't as such fall into medical imaging, but it comes under biomedical signal processing. So this is something I just wanted to mention here about this application. This is the same as epileptic seizures that we were talking in the previous application, which EEG is commonly used for detection as well as after detection for monitoring of that patient also. EEG based analysis is done in this work. Why they use EEG is it captures the electrical activity of the brain, so there is no radiation compared to other scans. This is less cost and it is portable, but there are issues as well. This is very sensitive to noise and the physical activity that the person is doing also. This is very sensitive. This is a very interesting biomedical signal processing problem. Epilepsy, you detect it from the abnormal electrical activity of the brain. For example, the left hand side is showing you the electrical activity that you would observe in different channels for a non-seizure patient, and the right hand side would show you when there is an occurrence of seizure. So far there are a lot of methods that could detect the seizure, but very few methods are there which could predict occurrence of seizure, let's say 20 minutes before, 40 minutes before, or 1 hour before. So this would be particularly helpful when someone is suffering from epilepsy and he is under monitoring, and if you know in advance, or if you can predict with a reasonable accuracy that there might be an occurrence of an epileptic seizure in the next 20 minutes, that would be very helpful. There are so far just 2 or 3 methods are available as of now. So this is something that one of our students, Samir, is working on, and in fact he got pretty good results here. Another application that some of our students are working is phase unwrapping for MR imaging. So MR imaging is a very important application where signal processing plays a very vital role. This is perhaps the only imaging modality where you acquire your image in the Fourier domain and then take inverse Fourier transform to get the image in the spatial domain. Yeah, some of you might be remembering that phase unwrapping is an important problem that you come across when you are dealing with Fourier transform and inverse Fourier transform. So again, this is a very important problem when it comes to MR imaging as well, where you are acquiring the image in the Fourier domain, and then in order to get the image in the spatial domain, you will be taking a inverse Fourier transform. So this is something where we are working right now to come up with deep learning based approaches for accurately unwrapping the phase, which is very critical in getting the accurate spatial information. These are the applications that we are working in our group here at IIT Tirupati. So I'll also mention 3 more applications that I happened to work earlier during my PhD and postdoc. One of the applications that I was working is automated segmentation tools for radiotherapy treatment planning of head and neck cancer. When someone is suffering from head and neck cancer, what would happen is there are certain regions here that are referred to as lymph nodes where this cancerous cells gets accumulated. These lymph nodes are something that act as filters where all these cancerous cells gets accumulated. In certain cases, the patient has to be given radiotherapy. Okay, it comes under the field of radiation oncology, and for doing that there are recently very advanced methods called as intensity modulated radiotherapy, for example IMRT. In that case, what would be required is, in order to, suppose we want to give radiotherapy for a particular region, that has to be delineated in the scan. So there are actually not just those organs, but also there are two things. One is referred to as target volumes and another is referred to as organs at risk. So both these things have to be delineated or labeled or annotated, and that has to be given as an input for your radiotherapy treatment planning system. And doing this manually is quite time consuming. Say for example, the studies says that it could take around 6 to 8 hours to do this radiotherapy treatment planning just for one patient, where an expert has to sit there and do it. So this work aims at automatically, using your image processing techniques, image processing methods, can we automatically label these things. Even if we are able to do it at an accuracy of 80% of accuracy, the latter, if the doctor has to, on top of it, has to correct if there are any errors, that would hardly would take maybe half an hour or so, which is still much better than a doctor sitting there, an expert sitting there and spending 6 to 8 hours of time. So this is again done with the hospital Freiburg radiation oncology department there. This is the problem where we want to automatically segment the regions of interest, both the target volumes as well as organs at risk. By the way, segmentation is a very challenging problem here, because for the structures that you want to segment here, you hardly see any contrast with its surrounding structures there. So because of that, conventional image processing techniques fail there. There are something referred to as atlas based segmentation. So those are the kinds of approaches that we would use here. I think at this point that information is good enough. Another application that I will quickly take you through is the fusion of 3D ultrasound and 3D CT images for the treatment of retinoblastoma. This is the work that has been done in collaboration with Lausanne University Hospital CHU and Geneva University Hospital HUZ in Switzerland. This is a childhood blindness, basically retinoblastoma, as they have tumors inside the eye, and this commonly occurs for kids around 4 years old and comes hereditarily. This is a very aggressive tumor. There are different kinds of treatments, and beyond a particular point, it requires giving radiation therapy to the eye to kill those cancerous cells. So for this, the conventional approach used is to take CT scan. CT scan is 3D anyway, and then in that you try to identify the tumors. There are certain landmark things here that tells you, for example, the tumor will be at the back of the lens of the eye. So they will try to figure it out and mark it and give radiation in those areas. But with the recent developments that have happened, now they could acquire the 3D ultrasound as well. The good thing with CT is it would give you a very good contrast for the bones. With the bones you will know clearly where the eyeball is, and also lens also you could see reasonably well in that. But the problem with the CT scan is you won't be getting a good contrast for the tumor as such. So tumor will be only partially visible. That textural changes are very subtle, and that you won't be able to see clearly in the CT image. On the contrary, in the ultrasound, this tumor can be observed well, but the problem there is, once you start looking into ultrasounds, you will realize that that's perhaps the most difficult imaging modality to deal with for an engineer. It has a lot of noise. You should understand a lot of things to see which is noise and which is the actual object of your interest. So there, while you could see the texture very clearly, the problem is you won't be able to see the boundaries, the bones very clearly, which are very important landmarks in identifying and accurately segmenting the tumor. So this work aims at combining, so the patient undergoes a CT scan as well as ultrasound scan, then you combine these two modes, so that's called as multimodal imaging. So that's what this work aims at. As I mentioned, this is done with Lausanne University Hospital and Geneva Hospital, and this is done in our EPFL team there with Dr. Mary. I partly contributed to this work. So there, what earlier the doctors used to do is, one scan is taken in Geneva and another scan is taken in Lausanne. So for example, ultrasound in Geneva, they will tell that from so and so landmark you go 2 mm and that's where the tumor is. And then here on the phone they will listen to it and then they try to mark it on the CT scan. So you could understand the difficulties involved there. This work is aimed at the fusion of ultrasound with the 3D ultrasound with the 3D CT scan, so that you will do the segmentations of the bones in the CT scan, you transfer them into the ultrasound, you nicely do the segmentations then of the tumor in the ultrasound. Now these two are mapped, so that information you again map it back to CT scan. The reason being the radiotherapy treatment planning is primarily based on the CT scan. So that information is again transferred back to the CT scan. So this is the scope of this work. So again I will skip the further details here. Except that I'll just show you here. For example, in the CT scan, you make a parametric modeling for the eyeball and lens. You could assume them to be ellipsoids, and then you define an energy minimization function and go ahead and do that. And then you transfer that information to the ultrasound. So whatever you look at here is an ultrasound. Ultrasound, by the way, has a very high resolution compared to the CT scan. So you could get the details of that tumor at a very high resolution there. As I said, once you know the eyeball and lens information is transferred here to the ultrasound, you know the boundaries of your tumor. So that you use it, you delineate the tumor here and transfer it back to the CT scan. The last application that I am going to briefly mention in this lecture is the early detection of dementia using MR brain imaging. The general word you could use for it is forgetfulness. This graph shows here the x-axis is showing clinical disease stage. So at what level can you diagnose it? That's what it is telling you here. Normal versus the patient with the dementia. So cognitively normal, from normal it comes to cognitively normal, then comes to mild cognitive impairment and dementia. The red curve is telling you where you could observe cognitively that person not able to perform in as somebody with normal brain would be performing. So before you see cognitive impairments, you could in fact see even before that some structural changes in the brain. So if one could analyze from the MR scan of the brain different structures there, we will be able to assess whether someone is going to get affected with, let's say, mild cognitive impairment. So that's the beginning stages, and then after that it could go to dementia. So the early detection is possible for dementia if with the analysis of the structural information of the brain. So that's what this is. While I was in the industry, this is something that I have been working on to give you how this happens. For example, let's not go into the details of what exactly the structures are, but in the center of the brain what you are seeing there is lateral ventricles. So you could see the enlargement of the ventricles, and also you could see changes, abnormalities in the hippocampus of the brain. So this study aims at what are the normal volumes and shapes and sizes that you could expect for various structures in the brain when someone is healthy, cognitively healthy, and somebody with mild cognitive impairment and somebody with Alzheimer's. For example, Alzheimer's is one kind of dementia. So somebody suffering with Alzheimer's disease. So this is a large study that one could perform. Again, image processing will be a backbone for doing such studies. So with that, I'll try to wrap up the applications that you would see here. We have seen, for example, the first application was using traumatic brain injuries uses CT scans. Then psychogenic non-epileptic seizures would be using PET scans as well as CT scans. And the third application is using, it's more like a biomedical signal rather than being an image, but that's where EEG signal is there. And the next one is a conventional signal processing problem of phase unwrapping in MR imaging. And the fifth one is a CT scan. Okay, sixth one uses both 3D ultrasound and 3D CT and fusion of them. And the last application using MR imaging. And you could also see here these applications also cover different kinds of analysis that you have to do. For example, there are cases where you have to do detection, there are cases where you have to do classification, in some cases segmentation, and in another cases developing the tools for doing the statistical analysis. Hope it gave you some idea of different possible applications in medical image analysis. With that, let's wrap up this lecture and see you in the next video lecture. Thanks for watching. Bye. Take care.